Very good morning to all. One of my residents asked a very important question to me. What is the difference between emergency medicine and a critical care specialist? So I wanted to make this point very clear to all the doctors working in Madurai. Emergency medicine comes under the category of specialization. Basically, there is a degree which they do after their MBBS, whereas a critical care specialist are those people who have done their post-graduation. That may be in anesthesia department or they may be a general medicine, pulmonology, and post that super specialization, they do the super specialization, that is critical care specialist. And if you look at the category of emergency medicine, they are trying to work in a uncontrolled environment, and they will be seeing vast spectrum of patients and vast spectrum of problems. But their short-term goals will be there. Basically, they don't need a diagnosis to manage the patient over there. And ultimately, the patient will be staying maximum about less than 24 hours in the emergency department. Whereas if you come to the critical care specialist, they are trying to work in a controlled environment. And most of the time, they need a proper diagnosis and management of the patients, and they should have a proper management of a long-term goal. Like they should have an idea about what they're doing with the ventilation, what are the type of sedation they are going to use. They should take care of the nutrition part. They should take care of the inotropic supports, how they are managing the organ crosstalks. In addition to that, they are also responsible for managing the relatives, because the patients are going to stay in an ICU for a longer time. They may be updated, so they should be good enough to manage the counseling part also. This is the very important difference between emergency medicine and a critical care specialist. And the next question is, can an emergency medicine can run an ICU? To my point, I will say no, as because they will not be knowing the diagnosis, they will not be knowing how to manage a long-term cases. So, but in case emergency medicine has worked in an ICU or has got trained himself to do a DM critical care, they have done the Indian Diploma in Critical Care Medicine, they are eligible to work or run in an ICU. Thank you so much.